Welcome to EDUSM. Today's topic is approach to headache in emergency department. Whenever you see a patient with headache in emergency department, always think of potentially life and vision threatening causes of headache. At least try to remember these 5 causes of vision and life threatening headache. The first one is subarachnoid hemorrhage. Second one is meningoencephalitis. The third one is space occupying lesion or mass lesion. Number 4 is temporal arteritis. And number 5 is glaucoma. Is it subarachnoid hemorrhage? Patient may present with sudden onset of headache associated with nausea, vomiting, diminished consciousness. It can be transient loss of consciousness, and there is neck stiffness. How about meningoencephalitis? Patients are usually febrile, drowsy, and there is evidence of meningism. Always check for meningism. Space occupying or mass lesion, for example, brain abscess or tumor. The headache is sometimes worse in the morning, aggravated by the Valsalva maneuver and coughing. Patients often have focal neurological deficits or fits. Temporal arteritis, typically females over 50, severe throbbing, burning, and unilateral headache. The ipsilateral temporal artery is usually tender. Glaucoma. The headache is usually in and around the eye. The eye is usually injected, the cornea edematous, and the pupil mid-dilated. Be particular to the patients who present with first severe headache or with a change in the quality and intensity or character of the prior evaluated headache. Don't simply say, oh, this is high blood pressure. Do not attribute headache to elevated blood pressure unless the diastolic pressure exceeds 130. If the history is worrisome, the patient should have a workup with a head CT scan, and if it is negative, a lumbar puncture to rule out subarachnoid hemorrhage. Do not say this is migraine for a patient who came in with the first episode of severe headache at the age of 50 years old. And be careful with opioid, because patient with headache and drowsiness, when you give a opioid, the drowsiness post-injection will make monitoring difficult. What are the focus examination of this patient? Number 1, review of vital sign, especially look at the temperature and the blood pressure. Number 2, always look into the fundus. Number 3, pupils, visual fields, face and extremities. Look out for focal abnormalities. And number 4, you should assess the gait. The next is management of patient with headache. First, look at the abnormal vital signs. If it is grossly abnormal and the conscious level is also very poor, the patient should be managed in the critical care area. Patients with normal vital signs can be managed in the intermediate area or yellow zone. And of course, patient has to have a good monitoring. ECG or cardiac monitor, vital signs every 10 to 15 minutes, and pulse oximetry. It's a good idea to have a peripheral IV line and get a good pain management for symptomatic relief of headache. You should order FBC, urea, electrolytes, creatinine, coagulation profiles, group and cross match, and ESR if temporal arteritis is suspected. The next thing is ECG and chest X-ray. What are the indications for ordering head CT scan? Number 1, the patient complains of acute onset of the first or worst headache. Number 2, there's increased frequency and increased severity of the headache. Number 3, the patient is more than 50 years old with new onset headache. Number 4, New onset of headache with history of cancer or immunodeficiency. Next thing is headache with mental state changes, or headache with fever, neck stiffness, and meningeal signs. And lastly, headache with focal neurological deficit, if not previously documented as migraine with aura. Disposition. Admit all life and vision threatening causes of headache. Admit migraine headache which is not responding to non-opioid analgesics. Admit complicated migraine headaches of new onset. And admit patient with headaches that requires CT scan. You may consider discharge the rest of the headache with analgesics and referral to the neurology follow-up, unless it is headache due to fever or tension headache.